My name is Tijani Aboba. I'm in charge of sales for Unitas Pharma Ghana Limited. We are here at Agogo Presbyterian Hospital to do a presentation on Pathelen Power. People are shifting from using antibiotics in curing of wounds or management of wounds to a non-antibiotic drug, which is Pathelen. So I'll ask, please, what are some of the processes or the drugs that you use in managing of wounds in your facility?
The patients having fever, pains, acute pains in the wounds and all that, then antibiotics become necessary to give in order to prevent sepsis and all that. So antibiotics has to be used in the acute phase. Subsequently, then you probably use local agents. The normal saline is okay. Time we combine with povidone dressing for the wound too, and then especially the diabetic wounds, which is always have multiple bacterial infections. Yeah, they may have to stay on antibiotics for about at least first 2 weeks when there's superimposed infection. Then if you're unlucky and there's spread to the bone, osteomyelitis, means that you may have to be on it for about 6 weeks, antibiotics for about 6 weeks. So depending on the situation. I'm Dr. Richard Kinyamiche, a physician specialist at Agogo Presby Hospital, Asante Akim. So I'm in charge of the medical departments, the medical wards, emergency, and the general OPD. So we see a whole lot of patients over here. For some time now, I've been very concerned about patients who have been coming with chronic ulcers, who are usually diabetics, but we haven't really found any specific solution to them. And I'm much devastated when it gets to a stage that they have to undergo amputation. So I'm always exploring options which will better suit them and better manage their chronic ulcer. As I was on the internet and then Pathelen just pops up.
So you got your solution.
Excellent.
There's no antibiotics, no way to use antibiotics. What we've done is that we've done a test trials in Kolebu, that is Pathelen Region of Ghana. So we're going to show you Jacob's story, who had a car accident. And the decision was that they needed to amputate the leg.
I'm Dr. Evans Asiedu Sifa, a specialist surgeon with Agogo Presbyterian Hospital. Agogo Presbyterian Hospital runs a lot of specialized care to patients within its surrounding and beyond. With the surgical department, we tend to see a lot of patients with wounds, acute and chronic wounds. Just recently, one of our patients challenged with the surgeons to use more innovative way to treat her chronic wound. For which reason, I started searching on what best solution we can have for such patients. And a physician specialist that I spoke to introduced me to Pathelen device. And then I read a little bit about it and I said, okay, let me give it a try.
Dr. Nyamiche can attest to it. He has used it on his patient before and it worked. It worked.
Yeah, a patient with a diabetic wound, yeah, who was so concerned. But I made her try it. And for the first time in 2 years, she has seen that. When they're showing signs of healing. And I immediately called them and said, hey, these guys, what have you brought like that?
Yeah. And I even referred a patient from Sekendi, I live in Takrady, to Dr. Nyamiche, and he gave him 1 bottle. Now, oh, no, it was a free consultancy. Yeah, it was a free. Yeah. It was free. He's a diabetic.
I haven't physically seen the patient. I'll be communicating with the nurse who is dressing the wound. And yeah, the nurse started saying that now it was easier to compress the pus out. And after the second week, she's seeing that the wound is now, she's now seeing granulation tissue floating up. So, yeah.
Yeah, this man in secondary had this wound.
This one is a defaulter.
Yeah, don't worry. He had about like 15 years ago that he had the wound, and the only remedy was to amputate it. So he was confused. So when he saw it on my status, he called me. But then because I didn't have any medical background, I called Dr. Nyamiche and he assisted me. Yeah. And now there's improvement. He's even giving me his colleague who have, he's now a distant. Yeah, referring patient to me. Yeah.
Pathelen wound powder has been a game changer in our treatment of chronic wounds. And what I deal with, especially diabetic wound ulcers, which go on and on without any end. And when they are on this Pathelen powder, it takes them about a week or two, and they are able to return to their normal work schedules, which means that they are able to get more income to their pockets and fend for their families. And they may not need that frequent admission and frequent visits to the hospital, where you, the doctor, will be required to review them every time they come in or to inspect the wound and to see changes. Because by 2 weeks' time, of them, they have started seeing changes and they are almost back to their daily living activities.
I use Pathelen. I've been using Pathelen. Yes, Namita can testify. Okay, and I've also watched the video Dr. Nsafo. But I'm very curious because whenever you are treating wound, one of the tools for assessment, okay, is also ensure that there's moisture balance. Moisture balance is very important for good granulation, tissue formation, and contracture and epithelialization. But you were saying that Pathelen, the wound should be dry. So I wanted to know if Pathelen add or donate moisture to the wound, or it helps absorb wound. Because the few times I have used it, it looks like it has an absorptive property. It tries to absorb a lot of moisture from the So if you have a very wet wound with a lot of exudate, Pathelen will do well. But for dry wounds, it may not donate moisture to the wound. So that's why I wanted to know the chemical composition, whether it's a foam or an arginate or something like that can donate moisture to the wound, or it's absorptive. That is why I'm asking for that. Yeah, it's very confusing. Hydrophobic, if it is hydrophobic, it has both of them. It's not possible. It's not possible. Those on surgical ward, anytime we use this thing, anytime we come, we have a thick exudate being extracted. Yes, Pathelen.
So it's already used.
Oh, I use Pathelen for patients who can afford. In this hospital. Okay. I've been reading on Pathelen.
Take out the moisture.
Wet, exudative wound. Pathelen will do very well. Because by the time you come, it has absorbed most of the exudates. So if you have very dry wounds, I doubt. Because it will take away the moisture that you need for granulation. So you see, I've watched the video from Dr. Nsafo. It's my senior boss. But you know, all the wounds that he compared were kind of dirty, very bad exudative wounds.
With Pathelen, I'm seeing results within a short time. There's one patient who actually called me on the 5th day of using Pathelen that for the first time in 2 years, he has seen changes in the wound healing. He has seen it turning red, means that there's granulation tissue, and this is a sign of wound healing. So by 2 weeks' time, this patient actually came and gave us a thumbs up that, I mean, he has been visiting a lot of facilities all throughout, tried herbal remedies and etc. And this is the first time there's been a solution. So in the nutshell, with Pathelen, you see remarkable improvements within a short time. Between 1 week to 2 weeks, yes, I see results within 1 week to 2 weeks with Pathelen.
Upon trying for the first day on the patient, our first patient, I saw a remarkable improvement with the drug on the patient wound healing. I started advocating for its usage in the hospital, and patients that could afford were introduced to it. And we've seen remarkable results with patient wound care here in the hospital. So I will recommend Pathelen use for very problematic wounds that are difficult to manage with our normal or traditional way of dressing wound and wound care.
I'll encourage all who are not sure whether to use it or not, because it's a new thing, they know whether it will work or not. I'll encourage them that as I have seen results, and after watching videos of colleagues who have also seen results, I'll encourage them to give it a try, because it is a device not really having any direct impact on the patient's normal physiological activity. So I encourage all my colleagues to try Pathelen wound powder on both acute and chronic wounds.